So my name is Susan McNeil, and I'm part of the senior management team at RNAO. I'm delighted to welcome you to our COVID-19 webinar. The topic today is recent directions from the province and policy implications from RNAO's perspective. And these are some of the topics that we're going to be talking about and more based on the discussion and how things continue to evolve. So in just a moment, our RNAO CEO, Dr. Doris Grinspun, will welcome you, and she will be facilitating the discussion. So one of the points we'll start out with is provincial decision and not to reopen schools. Also looking at advancing the reopening of the province to June 11th, which has just happened, and what that means for us. Touching on Bill 124, what to expect post-pandemic in general, and also specific to nursing. And I think we'll also possibly touch a little bit on the AstraZeneca vaccine and the expedited time frame that's just gone from 12 weeks to 8 weeks, and some decision making around that as well. Dialogue, questions and answers, and calls to action. So just to remind you that the webinar is being recorded, and we post all of our webinars on the COVID-19 portal. So if you haven't been there yet, please go to the portal. It's full of up-to-date and really relevant information to keep you informed, including these webinar recordings. And we ask you to use the chat box for any questions or comments that you might have. And then we do have the opportunity to unmute your line a little bit later. We'll keep your lines muted just right now to prevent background noise from distracting us. But later on, we can give you the opportunity to unmute your line to engage in the dialogue. And like I said, the RNAO portal to keep up to date, there's the link there. So welcome from Doris. I'll pass it over to Doris, and love this picture of you, Doris, getting your second vaccination.
Well, I need to tell you two things. No, I will tell you only one because we are being recorded, so I'm not going to tell the second. But a nurse should be giving the vaccine. If I may say, look at the location of that vaccine, you will understand the nurse should have given the vaccine. That's all for that comment. The second comment, more important, fully vaccinated. Guys, go, 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 because it's the ticket to freedom, right? You feel coming out of there, okay, I can see the light at the end of the tunnel. But the reality is, we only will see the light at the end of the tunnel if most people are fully vaccinated, right? So remember, children up to age 12 will take who knows till when until younger ones get vaccinated, because only Pfizer is looking at the younger age. So all of us that can get vaccinated, let's go and get vaccinated. That's number two. Don't take the picture out yet, because in this picture, I was saying that we were also asking for changing the intervals between the first shot of AstraZeneca and the next one. And before I left, I said to the person that was vaccinating me, look what I'm tweeting so you are aware and don't get upset. And I am saying we need to change the interval. And in fact, as I was finishing the blog, after all week that we had been pushing to change the AstraZeneca, because we had been in the media, we had been on Twitter with tons of retweets, I was finishing the blog, and in the blog I was explaining what the evidence says about changing the intervals. I get this click, click, ding, ding in my incoming mail. And it was, of course, the announcement by the province that indeed they were changing the interval. They changed it to 8 weeks. I don't know if they will change it to 4, but the evidence says that potentially you could change it to 4. And of course, I did provide also on the blog a fantastic article with all the evidence of what should you take if you got AstraZeneca on your second shot? Should it be Pfizer or should it be Moderna? And I think the verdict is there that both are equally good. Some say now that potentially Pfizer will be perhaps even better than Moderna. It seems to have less side effects for people. But you know what? If I was in your shoes, whichever one you are offered, get it. The Delta virus is very serious. It's much more aggressive as it is in that summary in the blog. So get it, convince your family, convince your friends, and let's get moving with this province to a different stage. And the sooner we do, the sooner also vaccines will be given to other countries that have very little in the form of vaccines, as you know. And whatever affect our other countries that are less fortunate than us, it affects us because the variants, you know, come from anywhere. They don't ask permission for the country from where they come, and once they're here, the vaccine may or may be less effective for them. So it's important to get the 2 doses for that purpose, and it's important to get them the faster we can, so we can then free up all the rest of the vaccines for others. Next one, please. Thank you. Maybe we stop for a minute on the issue of the vaccines, Susan, to see we have well over 100 people, 132 people, just in case people have specific questions about the vaccines, and we tackle topic by topic. What was my dose interval? 2 months. 2 months on the dot. It was supposed to be more, right? Remember, they had put us till August. And so it was 2 months, 8 weeks or 9 weeks, something like that. Yeah. Yeah. And it's because there are other questions and they called us.
Doris, there is a question on will it be more difficult for those who are vaccine hesitant to get their first dose later on?
I number one would urge you, for any of you that are vaccine hesitant or know of people that are vaccine hesitant, to explain to them the dangers they're putting themselves in. One aspect that I think my communications director said to me that the first time she heard it was from me, that I will repeat now all the time, is that, you know, with AstraZeneca, it was such a hoopla made about the dangerous cloth. First of all, they are almost nothing compared to the fact that the COVID virus itself, the disease, puts you at 5 times more risk for DVTs and for cloth. 5 times more, okay? So I know people have histories, I know people have fears. I actually think that all in Canada and in Ontario in particular, we will reach 80% of people vaccinated. I'm quite, with first and second dose, I'm quite convinced. Will it put people to get their first dose later on more at risk of not getting it? No, I think they will get it. Will it put them at risk of getting the Delta virus or other viruses that are now of concern, like the one from originating in Vietnam, etc.? Yes, it puts you every single day at risk. And because we are reopening the province, you put yourself or those that you know that are hesitant more and more at risk. So my recommendation is there is nothing to wait. There is nothing to wait. If the fear is what are the consequences of the vaccine, you ain't going to know more 2 months from now versus now. You know, for that, 10 years. But the vaccine is, from all we know, extremely, extremely safe. And we have had billions vaccinated. So we know it's extremely safe. And second, if there are other aspects of hesitancy that you have concerns, please send the questions, or that you hear from others. Please send the questions to RNAO. I will make sure to address them in the blog, if that's okay, Imagine. So we tackle the specific issues that people hear others or themselves to be hesitant. The other thing, the reason I put the picture is not only to get congratulations, which I got tons and was quite frankly pretty inspiring, but it's really to actually create excitement on the issue of the vaccine, right? So post your pictures when you get the vaccine, ask your friends to post the pictures. It really is a wonderful feeling, and also share it with others. And tag along RNAO, and maybe, Susan, we can start something like the maskathon. Maybe we can do a vaccinathon. We should think about that and post the pictures. Other questions about the vaccine?
Yeah, there are a couple of questions, more questions about the variants, Doris. One from Sheila, who's fully vaccinated and wondering if she's protected from the new variant. So you started to talk about that, but if not, will I need another vaccination with the new variant? So if you could speak to that. And then there's another one about variants too.
Yeah, so I will address what I know about that. And this relates to both variants that we have, the one originating in UK and the one originating in India. Remember, the vaccine doesn't prevent you from getting a virus. It prevents you from how ill you get with the virus, same as the flu vaccine, right? The vaccine doesn't prevent you from you transmitting to others if you get it, but if the other is fully protected, it prevents how ill. So basically, there is known case in Canada with the vaccines we are using of people fully vaccinated. And of course, the fully vaccinated means 14 days after the second dose, right? Not the same day. Being in a hospital in a critical condition or dying from the virus. And that is what's important. So it protects you. You know, when people say, oh, I'm not getting the flu vaccine because I got the flu shot and I got the flu and I had flu today or tomorrow. Well, that was not from the flu vaccine. You had it, okay? So the vaccines don't work the same day you put them on. In this case, we know that it's 14 days, right? So I, for example, got the vaccine on Saturday. I'm not going to go to stores right away and, you know, and when I go, I still will go with my mask. I still will go with the mask. There will come a time when they will tell us that we don't need the mask. I'm going to wait for a bit because I'm extra cautious with that, right? So that, I think, answers. Will we need a boost? There are talks about that. There are already investigations being conducted in countries where the virus is prominent. I'm sure also here they're looking into that. It is likely, not just for this variant, but for others that are in the, you know, of concern at this point, that we will need a yearly boost, very similar to what happened with the flu. You know, with the flu, every year we get a boost according to the strain of that year, likely the same.
Thanks, Doris. Can you can you talk a little bit about people waiting for second doses? Because I think that we're expecting large shipments. And so there are a couple of questions about people who are waiting for their second dose.
So first of all, you got the new, and Olivia, maybe you can pull from the government the new criteria for eligibility, right? I know that today people were already online registering. I also know directly that some persons have experienced difficulty registering and not being able to actually get an appointment. If you yourself or you know of people that are in high risk work, whether it is health professionals or whether it is people that work on warehouses, etc., or that they live in hotspots that did not get an appointment and you want us to intervene, I already said to one person today, we will intervene for you. But on that specific area of people that live in hotspots or are in special circumstances that they work in places like a warehouse, etc. Otherwise, there is a lot of vaccines coming. My view is that by end of July, we will have every person 18 and over that wants to be vaccinated. And as I said, I hope it's 80, 85, 90%. We are the first. You need to know that Ontario is the first in all the countries now. We surpass even Israel on first dose vaccination, not on second, but on first. But everybody that got the first will get the second, right? It's obvious to me. I mean, why wouldn't you, right? So I think we will do pretty well, but it will take some time to get everybody. But if you are experiencing specific circumstances, RNAO can intervene for you or for people that you know. Does that answer the question, Susan? The exciting piece is that we see people wanting to get the vaccine, right? More than what we see people hesitant to get the vaccine. And that's very important, both for you individually, your families, your communities, your workplaces, and individual good. Maybe related to the vaccine, I can address the issue of passports. It is a controversial issue, the issue of passports. However, RNAO's position is supportive of it, you need to know, because we look at population health. Of course, with the checks and balances that are necessary for it, and I address it in a blog, Olivia, you can look, I think not last week, the previous week even, when the passports were beginning to be talked about. Even in the US, that is so individualistic, President Biden already said that he will allow the business community to ask for passports if that's what they thought was needed, okay? Even that in Florida, they outlaw the issue of passports because of individual freedoms and rights. The president said yesterday that he will allow businesses to do that. I believe that we will have a significant push for not passports, but proof of vaccination. Hence why when Saturday we got the vaccination and I was going to put it on my purse, my husband says, no, please give it to me. So I put it together, you know, next to our passports, because no doubt that they will ask us wherever we need to go or we travel for proof of vaccination, right? Which is kind of, you don't call it passport, but it's kind of passport, right? So different countries are calling it different names, green proof, whatever proof. Keep that vaccination paper safe, because I'm quite sure that in nursing homes for employment, at some point they will start to ask it. Because if more variants come, they will be concerned about again bringing the virus to very compromised residents. And maybe in some other places of work, they will ask it. Remember what happened with the flu, that hospitals say to nurses, and we are supportive of that. Yeah, you have a right not to put the flu vaccine, but if you don't, then you need to go with a mask, right? And protection, not only for you, but for the rest. So I don't think this will go away. In fact, I know that all jurisdictions in Canada and the federal government are working on some type of proof of vaccination, call it passport or otherwise. And the public is pushing for that. Families are pushing for that, of residents, for example.
Thank you, Doris. And Renee just put in the chat box that link to your blog that really outlines that issue nicely. I see that Miriam's hand is up. So I'm wondering, Olivia.
So just 1 second. Nicole Parent put an important piece about Trillium Health Partners requiring employees to be vaccinated. And if you're not vaccinated, then to attend an information session. No, this is not unusual. Olivia, please Google it from the government again. This is a directive from the Ministry of Health this is for nursing homes, but any other health provider can use it. So this doesn't mean you are mandated to get the vaccine, but you are encouraged to get the vaccine. And if you don't get the vaccine, you are mandated to attend the education session. From an RNAO perspective, that's good, but not good enough, quite frankly, because you saw what happened in nursing homes, right? So I don't think that everybody that has vaccine hesitancy is ignorant. You know what I mean? That they don't know the benefits. There is other things going on, right? Some of it is hesitancy because of past histories. So the one-to-ones are very important. And some of it, much to my distress, and I say it with sadness, is political in nature. Absolutely and completely political. Okay. What happened with President Trump and encouraging people not to use masks, not to do this, go to gatherings, kiss one another, or what happening with MPP Hillier, that he coordinates these rallies, are not any longer about the vaccine or about masks. They are used for political reasons, and people fall into it or are part of it. And they're very, very serious. I'm not saying about MPP Hillier, but yes, about President Trump. They were very serious, proven links between what he was doing and very, very, very serious white supremacy groups. So we can send you information to read about that, but please don't think that vaccine hesitancy and the brainwashing that is done by certain groups about that is only about the vaccine. People fall trapped to it, but it's nothing to do anymore with the vaccine. It has to do with much more serious issues, political in nature and dogmatic and ideology in nature.
Okay, this is great, Doris. We have lots of engagement. So questions are coming in and we also have some hands up. So I'm wondering.
And I suggest that we tackle this topic. It's very important and timely now. And then if we don't get to the other topics of why the schools are not open, what will happen in September, we can tackle it next time.
Sure. I'm wondering, Miriam, we can promote you to panelist if your question is on this topic, and then Tracy Snyder would be next. So Olivia, if you can help promote them if their question is on this topic.
Hi, Miriam. You're able to unmute yourself and join the conversation.
Meanwhile, I can share with people that we have 160 people interested on the topic, so that's great.
Yeah, and while we're waiting, there's a question from Laura. Is it appropriate for RNAO to advocate to public health or government to make COVID vaccinations mandatory in schools once it is approved for all children?
So anything is appropriate for RNAO. That's number one. Anything that we believe is factual, evidence-based, and good for the collective is part of what RNAO does, right? We advocated for not reopening schools. We advocated for the masks. We advocated for a change in the medical officer, on the Ontario Medical Officer of Health. Always we advocate when something is important for the collective good, not just because we thought about that overnight, right? So if at some point and it's not now, we become convinced by the facts that mandatory vaccination is what's needed in schools, much like many other vaccinations, right? We will. But remember, at this point, we don't even have, right? All we have is Pfizer for 12-olds and older. Like Pfizer is the only one right now even doing clinical trials for younger than that. At the personal level, do I wish that they find that we can apply the vaccine to everybody? Yes. I myself have grandkids. I celebrated when my grandson 13 got this vaccine more than what I celebrated even when we got the vaccine. Like it's a relief as a parent, as a grandparent, right? But to make them mandatory, first you need to have it, and then there is a process for it, and keep asking that, and be assured that if at any point we become aware through epidemiological studies that that's what's needed, if we will become aware that that's needed, we will be pushing for that. The time has not come yet.
Thanks, Doris. Rose, we might need you to clarify your question, but I'm going to read it out. Rose asks, why would this not also be required in hospital and community nurses? Because they are working with the COVID positive patients, and community nurses go from home to home of people and could spread quickly there also. So I think she's talking about vaccination, but if you're not
She's talking about mandatory education.
Or vaccination.
Yeah,
No,
mandatory
she's
education.
talking about mandatory education.
Oh, okay, thank you.
So that's okay. So I think Olivia put that piece in the chat, right, Olivia? The government directive
Yes,
about
I
the
did.
mandatory
Yeah.
education. I believe that the mandatory education right now, but read it and interpret that, Irma Jean. I believe it's only for nursing homes at this point.
It is only for nursing homes right now.
Exactly.
You're right.
Do I think that needs to be for everybody? Absolutely, yes. Could we push as a RNAO for everybody? Yes, we could. So take note of that for someone from comms to connect with me, and absolutely we should, because I have heard more complaints from people that receive home care than from anyone, well, not more than the ones in nursing homes, but a lot of patients with compromised immune systems that really are very concerned that the people that come to their homes, whether it's a PSW or a nurse, that they're not vaccinated. Mm-hmm. And you know what? Then at least let's mandate the education for them. Why not? Absolutely, I'm with you. So thank you for raising that.
Great, thank you. Another question, can RNAO, if not already doing this, advocate for all 37 public health units to follow the same policies and processes? This should have been provincially driven. Tongue in cheek, as I have little, okay, well, I'll leave that, the rest of that, but yes, what's your response there?
So are we talking about all policies? Can you give me a specific example, please? Or are we talking about the vaccination priorities or what?
So Heather, if you can provide further clarification, that'd be great. For COVID protocols, it looks like, Doris.
Well, the protocols of the province, the criteria, for example, ought to be followed by all the public health units. So that is mandatory. There have been occasions, for example, the reopening of business, right? Not stage 1, stage 2, etc., but before. Well, and it would have happened now too, right? Stage 1 reopened on the 11th. It was supposed to be for the 14th. I can assure you that if the situation in Toronto would have been absolutely critical with ICU still at 1,000, well, maybe the province would, well, I'm assuming the province would not have been reopened because the 1,000 is provincial, right? But if Toronto specifically or Peel would be hugely higher, they would not have reopened so fast. Like there have been occasions in the past where there certain public health units have not followed the directive of government, and the medical officers of health, the local ones, have the authority by law to do that. But they use it very carefully, right? So hence why it's so important the push at the provincial level to do public health measures that are serious. And I believe that the current ones, where we are moving in 3 phases and where we are waiting 21 days between phase and phase, are very, very important. When the province advanced from June 14 to June 11, did we have huge concerns with the June 11? Not huge concerns, some with the June 11, but we would have preferred anyways to wait for the June 14 for 2 reasons. One is because it's 3 extra days of being cautious. Second, because we were also afraid that this will start to enable business to push that the 21 days become 14 days. And then every time you will be shrinking, meanwhile the Delta virus is going up and up and up, is predicted to be the dominant virus, the Delta virus, in the summer. And it's a virus that, number one, transmits 50% faster than the UK. And I shouldn't say the one originating in UK, the B167. I think I get the numbers confused. That's why I need to say from where originates.
I put in the chat box the numbers and the alpha, beta, yeah, and all that detail. So I can read.
Fantastic.
Yeah.
So I will refer to the Delta virus versus the first one that we had here, right? So the virus that originated in UK is already faster transmission than what they call now the classic virus, the first one we had, right? And the Delta virus is 50% more transmissible than the Alpha virus. So just picture how fast it's going, right? Thank you, that's very useful. That's very useful, Susan. So that's why we would prefer to stick to the timelines that were set by the science table. And for once, the Premier did listen to the science table. So let's keep them. Let's keep them, and let's not try to shorten 2 more days here, 3 more days there, because at the end we may pay the price. Instead of that, let's focus on vaccinating. The faster, the better. Full vaccination, right? And if we can do, I mean, we reached 200,000 a day the other day. That was amazing, right? And if we can reach 300,000 by using all the nurses that are ready to be leveraged to vaccinate, then let's do it. The faster we finish this, the better it will be for everybody, and the better we will be to have a good summer and to reopen in the fall school, if the schools will be prepared for that reopening. Vaccines enough, and that's the only thing I will say about the schools before we move to that topic completely. Vaccines enough will not suffice, because there is no way that children under 12 will be vaccinated before September. We don't even have a vaccine for them at this point, right? So to vaccinate all the children 11 and under, I don't think it will happen before September. And if it happens, will not be all of them. So the schools still need the fixing the ventilation. still need renovation if the rooms are crowded and you need to make them bigger so that they have space, etc., etc. And I have not seen much happening on that, except that today there was an announcement, I believe, that significant funding is being given to the schools for vaccination and for ventilation. So that should start to move us there. Olivia, you may be able to find the announcement in the website of the government. Anything else with vaccines before we move to schools?
Yeah, there was just a little bit more clarification about the consistent policies, Doris, in public health. So Heather was saying that these are more granular policies, like swabbing, testing, types of tests are different. The public health units are interpreting the government directives in various ways. And then Brianna added that, you know, there's some different policies about that cover infected patients who are also symptomatic, told to isolate for 10 days in one department and 14 days in another. So some inconsistencies across public health units in terms of practices.
Yeah, and nowhere have you seen the inconsistencies more than in relationship to also PPE, right? I mean, we know that this is an aerosol virus and we still are not completely behaving in that way. So I'm not surprised of what you are saying, and we can continue to push. I believe that we will, with the incoming Chief Medical Officer of Health, Dr. Moore, which, by the way, is the top performer in Ontario, if not in Canada, in relationship to COVID in his own public health unit. I do think we will start to see a more clear and more sharp directives in the go forward, and also faster reaction when necessary.
Thanks, Doris. I see a few outstanding questions here, and then maybe Heather or Imogene can chime in if I'm missing anything. A couple of questions I'll group. About the dose of 4-week interval, is that a concern in terms of immunity? Well, I'll just ask you that one first.
Are we talking about the Moderna and Pfizer, or are you talking about the
It isn't specified. Would a dose interval of 4 weeks be a concern in terms of immunity? Astra, I think.
Astra, I see that now. First of all, the government didn't go with our recommendation of 4 weeks. They went with 8 weeks. But I really suggest you read that. I wrote a really good piece on the blog on that. Specific, that was not addressed in the article that I also posted, which is about the doses. So NACI speaks about 4-2, right? The minimum is 4. What happens with AstraZeneca and the immunity is that it builds over time. So the more time you wait, this is why the lag time was longer, right? So yes, with 4 weeks, you have less development of you know, effectiveness of the vaccine. But the problem is that the Delta virus is more serious than that. So that's why we said 4 weeks, because the Delta virus is so serious that it's not as if you will stop developing the immunity. You will continue to develop the immunity. And what the second vaccine does is it increases the immunity much faster and also records it in the memory, right? So this is why we recommended 4 weeks. The government went with 8, which is better than what was, you know, what was. So I don't think they will move to 4 unless things get very serious with Delta, and then they will.
And speaking of Delta.
So it's a mix. What governments do is a mix of what's the threat, what's the availability of vaccine, right? And where can they deliver, right? And if you look this week, if you look at the vaccine tracker, We are using most of the vaccine. So we are really delivering very fast and very good now. The issue is that the speed of receiving vaccines will continue to increase exponentially. So we will be able to deliver more and more and more. And maybe at that point, they will decrease. Remember, it's what, only 90,000 people that got AstraZeneca, I believe. If I'm not wrong, I wrote it in the blog, I believe. And yes, you are correct, for Pfizer is 3 for the second, and it has been all the time. Yeah, but and to wait 3 months is absurd, and only was, well, let me backtrack. Let me backtrack from a policy perspective. It's absurd for the individual. It was not an absurd strategy, and RNAO supported that for population health, because we know that one dose at least protects a lot from dying from this virus, right? And at the time, we didn't have the Delta virus either, right? So it was the right decision. It was not the wrong decision. And hence why now we are cutting that significantly, right?
Thanks, Doris. So maybe you can just reinforce some of what you said before about protection against the Delta virus, because if people were vaccinated in April and May, this person's wondering if they are protected from the Delta virus.
Any of us are protected from the Delta virus way more, well, or quite protected if we get fully vaccinated, regardless if it was 3 weeks ago or 3 months ago, by the way. Even if you got the Pfizer 3 weeks ago, you are not protected from the Delta virus if you don't get the second dose, especially if, depending on age, right? And even younger age. I have never heard Dr. Bogusz. You know, he usually is very gentle in how he gives messages. If you compare it with, for example, David Fisman, etc. I heard him, was yesterday or the day before yesterday, saying in no uncertain terms, Delta will get you. Delta will look for people that are not fully vaccinated, and especially not vaccinated at all. Go and get vaccinated. So I say to you, if you have no dose in your body, you better put one. If you have one dose, put the second as soon as you can. Get into the machine to try to book yourself in.
Thanks, Doris. So Kaylee's asking, so I think this is an opportunity to reinforce a key point that you're making. Asking, is my first and second dose, if my first and second dose were 12 weeks apart, are my vaccinations still effective?
The vaccination, as the disease itself, by the way, builds immunity and doesn't go away like this. Okay, there are studies that show that it even lasts up to a year. I believe in Israel have done many of those studies. The issue is how much your immunity has built, right? So your immunity will not disappear after 12 weeks, will not completely, okay? But you absolutely need to build your full vaccination, which includes the second dose. On the Delta virus specifically, I'm talking.
I think one of the issues, Doris, too, isn't it the concern of what will happen during that interval, which is why RNAO is really pushing to speed it up if we have the vaccine, right?
Absolutely. And also imagine why we are saying, don't let your guard at all. Like we got the vaccine Saturday. I said to Ricardo, I'm not going to any store still.
Right.
I don't care that they're open, quite frankly. But you bet that 13 days from now, because it's 13 days from now, I desperately need to go to get a couple of things that I want to see them with my eyes, right? Not just order, and I'm going to go. Still, I will go with the mask. I'm not going to go without the mask until I know that most people, hopefully 90% have been vaccinated. I still will go with the mask because for me, it's not only about being hospitalized or dying from the disease. I don't want to get it, period. Like we took care, why did we push for the second dose for our nurses in the workplace? Because we want to protect them. They're all the time with COVID people with COVID. And I think we have gone through such lengths of disruption to our lives, not seeing family members, not hugging, not kissing people that you love dearly, not going to stores or to a concert or to whatever that every one of us likes. I loved going to the supermarket. I've been ordering stuff. I love going to the supermarket. Everybody has some different show that we like. I like supermarkets. But you know what I mean? I mean, I'm not going to go without a mask even when I have the 2 doses, Irmajin. But I will go when I have, in 10 days, 11, 12 days from now, I will go with the mask and kind of go to one of the aisles to see my own veggies, right? Don't let your guard down. Don't let your guard down. It's not worth it. Someone asked before about the mask. Will they continue to be mandatory, etc.? I think we need to get off the line of is it only mandatory versus what's comfortable for you, right? I can tell you, I'm not going to go into the subway or a bus, and that's what I use for traveling without a mask, even after the 12 days when I'm fully vaccinated. I'm not. I'm going to go with a mask. But that's each one of us, right? And I suggest, my hunch is that they will recommend to everybody to continue with the mask until they know that most people are fully vaccinated because of the Delta virus and whichever other virus that will come to us.
Speaking of masks, Doris, I'm going to ask a mask question, then we've got other vaccine questions. The mask question is, do you foresee masks being mandatory in healthcare settings, such as emergency departments, indefinitely?
I think indefinitely is a big word, right? I think when we know to what level of vaccination uptake we get, which will be, we will know end of August, right? It will be easier to know. It will be easier to know. I would hope that for the foreseeable future, the answer will be yes, Susan, because of the issue that even if we reach 90%, let's say, but kids cannot be vaccinated till I don't know when, right? Kids up to age 11. People live with kids. We all live with kids, whether you live with kids in your home or you have family members that are kids, etc. And then people come to work, right? So I haven't heard anything to the contrary. But you know what, Susan? Yes, I have in Israel, right? So in Israel, they're now not expecting you to use masks anywhere. But in Israel, a large percent of the population was vaccinated, and the other large percent that was vaccine nayers, quite frankly, got the disease. Many of them was hospital. Remember, they were vaccinated. They were vaccinating full speed when representatives came here to talk. Israel was vaccinating nonstop, and they had the machinery through primary care that we could have had too if we had used primary care, but but the rest, the hospitals continue to be full, and they were full because of those that didn't agree to vaccinate and they were ill. Remember what we have said all along in these webinars and in the staff meetings, Susan and Irmajin and colleagues. The virus is not trying to kill people. The virus is simply trying to survive. And to survive, the virus needs to spread. So the virus will find people that are not vaccinated because otherwise it cannot spread. And that's the job of a virus, is to spread. Simple. Explain that to people that don't understand. You know what I mean? The virus job is to spread, like every single virus. Not to kill. What does a virus know if it's killing or not? Needs to spread, to continue to grow and mutate.
Doris, I'm going to ask one more vaccine question, and then I think Irma Jean's got a couple that she's been collecting with policy implications. So this one is, I'll just read it. When do you think we'll know more about the third booster? People with full vaccination of AstraZeneca have lower protection than Pfizer or mixed. Would a third booster help heighten their immunity? So I think there are a couple of things you might want to say in response.
Yeah, so first of all, it is correct, and it's in the article in my blog, that AstraZeneca to AstraZeneca has less immunity than AstraZeneca to Pfizer and AstraZeneca to Moderna. I think AstraZeneca to Pfizer so far is the best from what they show, but it's still excellent, the AstraZeneca to AstraZeneca. So I don't want to get people afraid about, oh, I got second AstraZeneca. I wish I knew, because I think it's very strong still. I think that the issue of the booster is being studied, and it's not only for AstraZeneca, it's for all the vaccines, and it's because of the mutations. And I think there is no conclusive studies at this point, but I think we will know in the next couple of months. So far, I believe that in Israel, the decision, and I'm using Israel because they are ahead of the game on having people fully vaccinated or sick, so their immunity is very high. I think that they're saying now that for a year they need no booster, regardless. Well, in Israel, they gave only Pfizer. That's the only vaccine they used. So I don't know. We will hear, I'm sure, very soon from either the US or from even us, but from the US usually.
Okay, so then I'll just ask my two questions. The first is around the vaccine again. Is RNAO aware of any problems of procedures in vaccine centers where people are being mistreated, such as misplaced appointments, etc.? In the US, entire communities like the Black community has voiced that they are concerned regarding hostility from vaccine centers in many different ways, and that's by our Pinto.
Yeah. So I have not heard of any groups in Canada, whether it's our Black colleagues, friends, families, or whether it's Indigenous, that have been mistreated or mistreated in the centers. It is absolutely true that racialized communities, not Indigenous, I will speak in a minute apart, that racialized communities in Ontario have been underserved in relationship to vaccination, and that has been now remedied or attempted to be remedied with the push for the treating the what's called hotspots, which is not a good name to put on a community. How did it happen? Number one, those communities have less pharmacies. And remember, a lot of the vaccine at the beginning went to two places, hospitals and pharmacies, remember? So by de facto, those communities were underserved. those were the communities that we definitely saw in our ICUs. We saw in the third round in our ICUs, people from racialized communities that either live in communities that are underserved, and also people that work in warehouses that, you know, were underserved. If you remember, RNAO begged the government and Dr. Williams and the public health units to take the vaccines to the people in the warehouses. The same as we asked to take the vaccines to the nursing homes, we also asked to take the vaccines to the warehouses. Why? Because the employees don't have sick days, they're in precarious employment. The employees many times live not by tradition and not by choice, but by wallet in multiple generational homes, because many of us can live in multi-generational homes, but depends the size of your wallet if your home is big or small. Meaning if you live in a place that people are, you know, more crowded together in the home, small apartment, versus in a home that is spacious and they live 3 generations, but they live spaciously. So that's not by tradition, that's not by religion, that's not by, you know, custom of your upbringing, that is by wallet. And we better say it the way it is, because it's nothing wrong to live in multi-generations. And it's nothing wrong to have our own upbringing and traditions and religions, and we need to respect them all. But what's wrong is that people live in minimum wage without sick time, and can afford this little thing because they can, that's what it is, it's the money, right? So yes, people ended up being in ICUs from racialized communities for the reasons I just explained. For the same reason of the terrible tragedy of Islamophobia that happened in London. It didn't happen because 4 family members, 5, were walking in the street of London. It happened because of Islamophobia. And until we don't recognize what we are living, we ain't going to fix it. Whether it's about income, in the case of who ended up in our ICUs in the 3rd round, or whether it is about ageism in the case of nursing homes, or is it about Islamophobia? And we need to call it what it is, colleagues. And we need to be part of the solution, both in terms of calling it what it is, standing up, trying to learn, not about the other, trying to learn about us as people, and what values we have. It just gets me very passionate. I'm sorry, right? It gets me very upset, the whole situation, and I think we all are part of the solution. So I hope I answered the question. Imagine I went to another place.
I think so. That was fabulous. And I have one more, and then I'll turn it to Susan. Has there been any thought given to asking the government to differentiate between long-term care policy and retirement home policy? These are 2 very different communities. As an essential caregiver to my 97-year-old healthy mother in a retirement home, I am still required to have bi-weekly negative COVID tests. I have had 22.
Yeah, it's because retirement homes, from a policy perspective, in more than one way, have been pushed, not pushed, because I think retirement homes, the industry likes it, right? But from an RNAO perspective, they have been pushed to take clients to serve people that, in the view of many of us, RNAO as a whole, should be really in nursing homes, right? People that are way more complex than your mother. So that is why the same directives that apply to nursing homes were applied to retirement homes is because in many of the retirement homes, the clients are very compromised, way more than in the past used to be.
Mhm. And I think the Auditor General's report out much earlier absolutely confirmed that.
Here you go.
Okay, Susan.
Okay, I think I've got one last question. And then there's also a request that we maybe move on to some of the other agenda topics. So the last question I've got here from Michelle, and Michelle, again, we might need a little bit of clarification on your question. I want to have information on knowing how long the Delta variant will last. And even if they isolate for 14 days, does this mean the Delta virus is dormant then?
So first of all, how long it will last? It will last until a new one comes and takes over. This is exactly what happened with the other ones, right? So there are a couple of variants of concern now. And let's hope they don't get here. That's all I can tell you. Let's hope that people get vaccinated fast and take the precautions if they're not vaccinated or not meeting with other people that are not vaccinated, that are necessary to stop the spread of even the Delta variant. But equally important, if they travel to I don't know where, not to bring the variant here, right? Because there are other variants of concern. So it will last as long as it will last until people either are herd immunity on the mix of how many are vaccinated. Herd immunity is both, right? It's the sum total of how many have been vaccinated, the percentage of population vaccinated on any given country, community, plus those that were ill, because those that were ill with COVID have the immunity. And so that's number one. And number two was about how long. What's the second question, Susan?
Well, Michelle just wrote a little bit more. So she said her question is driven because there are people coming into clinics who've been exposed, who had COVID, and no other testing was done. And then they
because
stopped
we don't have a
isolation.
test. We don't have a test, as far as I know, at least till last week. There was no test. Canada is not doing the test for or Ontario, I think Canada is not doing the test for the Delta. So what they know is this number of people have COVID. We tested for the other variants. It's not that, so we assume it's Delta.
Okay, thank you, Doris. So it's 3:06 right now, and I think we've gotten through these questions. So maybe let's move back to the reopening in schools and see if there was anything more you wanted to say there.
So I know number one, actually we didn't get any complaints from RNAO, but people external to RNAO, not everybody was happy that the schools were not reopened. We were very, very supportive of that. And for a very simple reason, we were talking about 3 weeks of reopening. Does RNAO believe that schools are important for children's health? And I'm talking all of it. You know, many people talk about mental health. No, I'm talking all of it. Schools are important for the social health of children, so they learn to interact with others, for the emotional health of children, for the cognitive and scholastic health of children. Schools are important. Of course, I don't think anybody in the world will not believe schools are important, except if schools are so important, why did government not prepare schools for reopening? Why did government, when RNAO put the call last summer, I believe in June, we put the call. And if you look, imagine in the website under reopening schools, you will find our position statement that we sent and spoke with the government back then, prepare the schools, same issues we are talking now. We didn't mention as much ventilation because we knew less, but all the rest we did, class sizes, etc. Nothing was done, I'm sorry, nothing was done. And if nothing will be done now, which also requires ventilation, we will be in a pickle in September again. Because if whatever variant comes here that is even worse and requires more cautiousness, I tell you that Dr. Moore will be very sharp on that. So the pressure needs to be now on preparing schools for a grand reopening in September. The pressure, in our view, from a policy perspective, needs to be vaccinate, 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 vaccinate. Full vaccination, anybody 12 and older. As soon as vaccination is ready for younger kids, vaccinate, 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 vaccinate. Third, do not let the guard of other public health measures ahead of time down, because the virus will catch us. The virus doesn't sleep, doesn't take weekends, doesn't take vacation, doesn't take nothing. And fourth, prepare the schools. Prepare the schools for a grand reopening, because if all goes well, we will be able to reopen, even if the little ones are not vaccinated. But then what we need is the proper ventilation. This is an aerosol virus. We need the ventilation. And some people, like David Fisman, have been saying this from day one, in fact. Top epidemiologists have been saying about this virus from day one. We cannot afford schools, classrooms that are not well ventilated, because we live in a very cold place. In the winter, you cannot just open windows, right? And we also need to have classrooms that are not completely crowded. And the rest is vaccination and keeping our masks and keeping protecting one another until such time as it's safer to do otherwise. So that's where we need to focus. So we were supportive, we are still supportive. You know, when people will say, oh, but you see the numbers are going down, except they were going up yesterday again because of Delta. The numbers are going down. Yes, the numbers are going down in part because schools are closed. You know, the spread was not only in communities that happened community spread. The spread happens on schools that were open. In fact, yesterday, I don't remember in which province it was mentioned about the school they needed to close because community spread started again. We're doing well, relatively well, right? Because the schools are closed. It's not that we closed the schools and look, we could have kept them open because we are doing well. No, we are doing well because we are doing the right things this time. So I hope that helps for people to understand. And if you think I should write about that, let me know, and that can be a blog that I can do as well.
Great, thank you, Doris. So do you want to move on to the next topic then?
Sure. Unless people have questions, let's give a minute.
I didn't see any questions unless
Okay.
Heather or Ermagine did about schools.
No, it doesn't look like it, no.
Yeah, and Heather
Someone
just,
has said it would be a great blog, Doris,
I
just
will,
what you said.
absolutely, I will.
and Christine says, not all children are out of school. I have a patient in school.
A patient. So that is correct and has been all along. Children that have special needs are in school and their teachers have been fully vaccinated. They were when we push for nurses to be vaccinated in the workplaces, one of the groups mentioned also as priority groups were special ed teachers.
Great. And yes, Chantel, we'll share the blog link in just a moment. We'll put that in the chat box.
And if some of you are not members and don't get the blog, number one, become a member, please. It's only $50 now, and you will enjoy not only the blog and not only these webinars, but a lot of other important work we do. And if in the meantime, give us your email, and we will put you in the list so you get the blog, please. We can put you in the email list and you will get the blog.
And all of the archive blogs are on our COVID portal as well. Okay, so we'll move to the next topic. You started to talk about this earlier, Doris. I don't know if there's anything more that you wanted to say about advancing the reopening of the province that started June 11th.
Yeah, so the only thing that I want to mention is your understanding of, if you hear us push 21 days from now, 11 plus 21, whatever it is, that we will say, no, we don't want to advance the date. No, we don't want to advance the date. It's because we don't want to keep advancing every single date. If anything, we want to drive to COVID zero. And COVID zero, it doesn't mean you have completely zero COVID, but it means you can live a normal life, because anytime that there is a touch of a blip, right, you suffocate it with public health measures. That's what countries like New Zealand have done, right? Last summer, if you remember, we had 100 cases or less. We could have driven to COVID zero. We could have easily. Instead, we kind of opened everything and said we will have a great summer. And the results, of course, was a second wave. And then when we didn't act quickly on the second wave, and we again reopened more than what we needed, we ended up with the third wave. We don't want the same. We don't want the same, not only because at the worst of it, people die from this virus. We also don't want it because you have not heard enough about the, strugglers, the people that stay with symptoms for months and months, and who knows, maybe even years. We don't know enough about that, right? Also, that is not good. And also we don't want, because our colleagues in the front lines cannot handle it anymore. To tell you the truth, I have an interview at Forum on that. They simply cannot handle it more. And many people are leaving way more than what even our survey said. So we need to put a stop to this. We need to put a stop to this, because there is life after COVID. There is procedures and surgeries that people need after COVID. And all those people are being postponed. And we cannot do that, right?
Doris, do you want to talk about what to expect post-pandemic now, since you're just starting to kind of get on that topic, and then we can go back to Bill 124?
Yeah, so let me talk what I expect in general. In general, not only about nursing. I expect a very small percentage of the population, well, I don't know if small, 30%, will go back to life as if nothing had happened, with no impression in their souls or minds after this. You know what I mean? We'll just get back to normal, with no changes in the way they are, or they think, or they feel. I think most of us, and I include myself in that group, will have taken pain and advantage of this. By then will be 20 months, who knows, we're already in 16, going to 17, to be more reflective in general in life, to be more, even for those of us that are very impatient like me, to be more patient on life and on everything else, to be, and in that sense I say like me, more loving of everyone, and I don't want to say of the other, of everyone, to be less judgmental. I think people are very judgmental, and for no good reason. I think if we make the best out of it, if we can, if I could think about one silver lining of this horrific virus, was that we will have a kinder society. And it's difficult to say this in the context of what just happened in, the Islamophobic terrorist attack in London. It's difficult to say it. But I believe on humanity, and RNAO believes on humanity, and I hope we can have a kinder society. And also one that enjoys more the minute. And I hope I can catch some of that, right? Yes, let's keep going for big goals and big things, but also let's enjoy also more the minute. And I am very, 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 very concerned about what's happening in nursing. And my next column is about that. I think great things have happened to nursing, but they can go also very wrong, and by extension in other professions. I think that we have gone through 3 phases in nursing, and in other professions, maybe they parallel, I don't know. The first was simple fear, like many people, and response, like nurses were fearful of bringing the virus home, fearful of what was coming into the health system, how big this crisis would be, right? And they responded beautifully, right? I mean, nurses were like really out there, responding to every need that people could need, whether it's in their workplace, communities, hospitals, nursing home, etc. I think the second phase is restlessness. I think nurses became very restless, and I think you can parallel a bit the teachers there. And I think we started to see what I would call moral distress. And for those of us very involved in the Twitter world and in the social media, I saw it expressed by colleagues. Moral distress about what they were seeing, and RNAO too, by the way, what we were seeing in nursing homes, moral distress about the way that, to a certain extent, nurses were taken advantage of. Cancel your day off, cancel your vacation, cancel this. And if you work part-time, too bad, you don't have sick time. If you need to isolate because you were exposed to the virus, but you're not positive, you don't get the time paid. And RNAO went to fight for these nurses. So, but that didn't avoid the moral distress. And I think the last phase, I call it revolution. And it both inspires and excites me. It also scares me very much, because revolutions can go very well and revolutions can go very wrong too. You saw that in many true revolutions in the world, right? And I hope our revolution will go well. And why do I say revolution? Just watch the tweet, right? What nurses are tweeting about what they see with patients, that I'm leaving, I'm selling my house, I'm going to the US. Whatever comes to their mind or whatever they are seeing, they are tweeting it. That's a revolution, right? And we are giving it oxygen in the sense that we are connecting some of these people even with the media. But we are also looking at it, and I've spoken with a couple of colleagues that tweet, that we need to do it in a very responsible way, because we cannot collapse this profession. I, for once, didn't spend 25 years at RNAO to collapse this profession. I spent 25 years at RNAO with many of my colleagues that are in the call today, whether as staff or as members, and many that are not. And let me remind you of my dear friend, Charlotte Noskar, that passed away, not from COVID, but passed away. Just for a second, she came to my mind. She also gave her soul to nursing, and it's not to collapse the profession. So I want this to be, and when I say I is for RNAO, we want this to be a very responsible revolution, a revolution that leads to a more outspoken nursing and nurses for change for good, for the type of change that nurses are tweeting about. But for that, you need to bring solutions. That's why one of my tweets this weekend, when a piece came in the Ottawa Sun by Liz Payne, or Olivia, you can put it there because it will be good that people not only retweet it, but also put their ideas. I ask people to put ideas, right? Because this was she called me, Elizabeth Pine called me about, do you think bonuses are good for hospitals that are giving bonuses for people to come? Well, that's a very simple question. And my answer was bonuses are never good because they destabilize our profession, because they move people from one sector to another. And then when the other will give a bonus, they will move it to another. It's not the solution. The solution is, for example, do away with Bill 124 and let the unions, ONA for RNs, others for others, negotiate fair wages for RNs, for RPNs, for everything, right? The other piece is bridging programs from PSWs that can go to RN or to RPN depending on their background, right? We have one now, Diana, that is, maybe she's in here, and if you are Diana, please pick up. PSW that is going to Ryerson to the RN program. And I connected her with the media when I became aware through Birgit Maigva. So bridging programs for people to have a career in health professions. The certifications for ICU nurses to be paid always by the employer in lieu of 2 or 3 years at that workplace. More seats for baccalaureate prepared nurses because the shortage is in RNs. More seats for NPs because we should be 3 times the number of NPs we have if we are to cover nursing homes, and if we are to cover rehab places, and if we are to cover vulnerable populations in the streets, etc. So there are so many things financially that we could be doing much better for nursing that is not a bonus, because a bonus I don't think is a solution. But I invited solutions. I invited solutions, and I invite you to do solutions. And we are doing the 3rd survey, which you can put the link. So it will be good if you retweet this. And if you add ideas here, please, that's number 1, if you can take a shot of that. And also will be good if you sign the repeal Bill 124 action alert, which Renee can put on the chat. Please sign that, because I do believe that we can get the premier hopefully to repeal it completely, but at the very least understand that if you want to save nursing from a collapse, you better repeal it for nurses at least. And I mean RPNs, RNs, every nurse. And other ideas, right? There are so many ideas like we used to have. Imagine, and I remember when, and I know Barbara Anderson is in the call, you will remember when they used to bring the baccalaureate program or programs from RPN to RN, we brought it to Sinai, right, to the workplace. Mm-hmm. We had PRL, prior learning assessment, for people that came from other countries or that have been already an RPN for I don't know how many years to recognize aspects. I think some of those things that look from past history, we may need to bring back, but we cannot, and RNAO will not allow this profession to collapse. I can tell you that much. We will do everything we need to do. We will not allow anyone or anybody to collapse our profession, not from within nursing and not from outside nursing. So we need to bring solutions, and we need to create consensus on which solutions to push forward. And yes, I have asked already government to launch a summer summit for dealing with this issue, because my fear is that if not, come September, we will have a mega problem because all the effort will be put into the surgical procedures. There is a backlog of 3.5 years of surgical procedures. It will become 7 years if we don't have enough nurses in ICUs, right? So one colleague said in one of those solutions that nurses working in critical care areas need to be paid more. That's a perspective. I didn't give my perspective. I asked a question. What is a specialty? Is rehab a specialty? Is long-term care a specialty? Is psychiatry a specialty? Like, we need to answer those questions. For sure, we don't want to end up like the dogs, that with all due respect, why is it that primary care was not fully used for vaccination? Because they don't have the power as the specialists that work in hospitals that are the ones vaccinating us, right? This is what happened. The vaccines were given to hospitals. For the most physicians that have a specialty and could not, make their income because surgeries were cut to almost none, right? They ended up vaccinating people at a fee schedule much, much higher than what it would have happened in primary care. But the reason I'm bringing this is not to talk about the physician schedule. It's about what we want out of nursing in the go forward, right? And of course, in those conversations of paying more to this group versus other group, it is vital that we also involve ONA, because yes, they are our partners and they are our labor negotiators, and I'm sure they have a very important perspective on this. So to be continued. As for thoughts for the future, Susan, to be continued.
Okay, thank you. So I was just looking up some other answers to respond to some of the questions in the chat box. Let's see what I can, I'll give
and
you.
By the way, I think we are very close. We may have surpassed the 5,000 already. So that slide we need to change in the go forward.
Okay.
But more importantly, we need everybody to sign so we get to 10,000.
Yeah, we are close to 5,000. And Susan, while you're looking, I've got 3 different questions. I think in terms of the post-pandemic, there were 3 areas I saw in the questions. One is about the long haulers that you spoke about. And do we have any idea of the numbers who might be in the long hauler category?
More than numbers would be the percentage, right?
Yes.
Yeah. I haven't looked into that, but I commit to look into that and get back to you, to colleagues. And again, that might be a good blog for me to do some homework, because this is how I look at those issues. I do homework and then it serves us all. So thank you for posing it. I promise to work in that.
Okay, and then another in terms of the need for mental health counseling post-pandemic, and 2 areas were identified. One, the post-traumatic for many nurses and others on the front line, and 2, the issue of stress related to going back to normal.
Yeah, a very good point, the last one. We went into a walk with Ricardo the day of the vaccine, and I said to him, wow, it will be interesting to go back to stores and all of this. How will one feel? So good point, good point. First of all, and that relates also to stress related to, for certain people or some people, or a percentage, not certain people, but a percentage of people, of going back to work, right, in offices, including our own when the time comes. I think that the first is more complicated than the second. I think that the second the issue of the stress of going back to normal speaks about two types of normal. First of all, your own personal normal, and I would suggest for any of us, reflect and don't make your new normal the same as the old one, because then we didn't learn anything from it, right? So that's number one. Number two, I think employers, good employers, will have a lot of things and a lot of ways by which we need to do our own offices reopening, right? To exactly tackle the issue in a way that people feel less stress, imagine, right? So not to bring everybody together at the same time, to create the atmosphere where people can talk about that, to create the protections that are necessary, etc., right? To demand, if there is such a thing, for example, the issue of the passport or proof of vaccine. Many have asked me, both as a RNAO employee and otherwise, employer and otherwise, will we be asking for proof of vaccine, because actually they want that, right? And so it's not just the right of the person that doesn't want to vaccinate, it's the right of all of those that vaccinated and want to be protected. So there will be legal frameworks, there will be aspects that we will be able to do within and outside those legal frameworks, similar to what Trillium is doing now. They were not mandated to do the education program, but they said, hey, we are uptaking it. No one can say to us no, right? So that's number one. Number two is the issue of the PTSD for having worked in the front lines in difficult areas. And this is not only about long-term care, it is about long-term care, it's also about ICUs, it's also about so many other areas, emergency room, I'm sure, and many, many, and not only nurses, paramedics, etc., right? It's like working ongoingly in trauma, right? Those that are giving vaccination is the opposite, right? Is joy. You're seeing people that come to get vaccinated and everybody's happy. It's very different than the ones that are struggling with seeing devastation. Many workplaces are doing programs. If you look at the survey that we did some time ago and that we released at RNAO, it spoke about people a moderate degree of satisfaction with employers. I think employers have learned also to do more of that. We will see that in our survey. Please put the survey so people will remember to respond, the international one. We will see also what are best practices that are being done in other countries and what are the best practices here. If you can put the survey, Olivia or Susan.
Yeah, we've got it right here. I'll put it in.
Okay, thank you. So at RNAO, we are going to work on a nurse wellness we will expand our nurse wellness program to continue with these webinars and other forums that we have, including Facebooks that we have going already since the beginning of the pandemic. But we will augment that with what we learned from the 3 surveys. So just to remind you, the first survey was a survey with 7 other professions across Canada. And we will have, and it's related to mental health, during mental health needs and needs and responses that need to happen because of COVID. We should have a report from that survey in August, and we will look at it, and we are involved on that survey. RNAO was one of the partners. The second survey is the one that we did, and the response is in our website, and colleagues can put it in the chat. And the third survey is international, and is for RNs, RPNs, NPs, PSWs, midwives. RNAO only included RNs, RPNs, LPNs, and NPs, and we are driving it across the country. and is a RNAO, a research unit in Australia that did the validation of all the tools, and Nursing Now, and it's about 155 countries, and we will be able to see what's in common and what's different in Canada and in Ontario in particular, vis-a-vis other countries. What's the same, what's different between RNs and RPNs? I don't expect a lot of differences there. And what's different between those groups and NPs, etc. And we will ascertain then between these three surveys, which we will analyze end of the summer, we will ascertain what are the constant in the three surveys that we need to tackle first, because whatever is consistent across the three surveys, we need to tackle first. And then what other aspects we need to look, and what other practice have been best practices in other countries. This alongside what we are already doing and the policy changes that we are succeeding to have, because there have been successes in the policy arena too, like increasing seats that are RNAO secure for RNs and that expanded also to RPNs is an important thing. We are also pushing for increasing seats for NPs, and I'm very hopeful on that, that will happen. Bill 124, we will see what happens with that, and other aspects that we are discussing with government that hopefully will succeed. We will build on those programs to support. The mental health aspect will be dealt with the toolkit that the researchers from Ottawa will be working as a result of the survey. We are involved with them, and we will be involved in that toolkit. And then other aspects that we are and will be working related to the other surveys too. And we will bring this back both to these forums, as well as especially to the forum of Heart to Heart that we will continue to have, because that's where we will test ideas related to specific to nursing more than to health system transformation. Does that help to answer the question? Or anything
yes,
else that was not clear?
that was wonderful.
Great. Doris, I'm wondering if there are a couple of questions about violence that nurses are facing. One question reads, with the amount of violence nurses face for the limited financial compensation and high stress, maybe addressing some of the violence against nurses and holding perpetrators accountable. Maybe that would have a positive effect on the shortage. And then I'll just say that Judy says that vaccinators are receiving a lot of negative issues, and well, not particularly violence, but negative issues from those who show up not eligible for the vaccine. And also stress from
meaning people that come to be vaccinated but are not eligible.
Correct. And then also the anti-vaxxers too.
Sorry, this is two different things. Anti-vaxxers or people that I'm assuming is anti-vaxxers.
It's actually both, like the stress of dealing with people who are, have negative reactions to nurses who show up because they're not eligible. So you have those people, and then you also have the anti-vaccinators. So
I'm curious how the anti-vaccinators target a specific nurse. Aside of this one, which I simply go like this. And you have no ideas. You have no idea. The threats, the letters, you name it that I have received. Complain to the college, by the way. I go like this, and that's what you should do. Because what they're doing is against the science. What you are doing is with the science. That's it. That's the answer to this. So no program can help on that except of the premier giving tickets to anti-vaxxers, which is what they should do. And they some days they do, some days they don't. But the others is more concerning, because the others it's people that basically show up without an appointment, and they get upset with the nurse. Then, you know what? I suggest if the colleague that wrote about this can give specifics, If you can write to Imagine if you can take the email, just because I don't want to miss it.
Yes,
And then
absolutely. I'll
be more
put
than
my
happy.
address.
I will be more than happy to respond through you, Imagine, because it's an
Okay.
issue to tackle both about the anti-vaxxers and about the upset no appointment or whatever is the issue. We will answer, and we can tackle both of them easily.
Mhm. Actually, in my experience with that at vaccine clinics, there are a lot of different people that come between the entrance and the nurse giving the vaccine. And I myself have witnessed 3 or 4 different people talking to those who have come who are maybe not eligible. And there's been so much effort taken to work with these people, but they do not get near the vaccinators from my experience.
So let's connect. Thank you, Imagine. That's important. Let's connect with the colleague that had the question. If you can write to Imagine, we will help you. We will help you solve the issue.
Yeah, and I put my email there.
Thank you, Imagine. And if the issue is bigger than only with you, we can have a meeting. Imagine and I can have a meeting with you for like 10 minutes to get what are the aspects, and then we can take it from a policy perspective, Imagine.
Okay.
Great, thank you, Doris. There's another question from an RPN who's nearly finished the bridging program. And
Congratulations.
yeah, so this person says, I feel like there needs to be more government assistance on affording the transition. Is RNAO doing any advocating for loan forgiveness or OSAP relief for people entering nursing or upgrading their nursing degree rather?
That's an excellent point. No, we haven't, but that's not to say we can't. That's the type of thing that in that tweet, I was asking ideas. Never heard about this idea. Brilliant. Please send me an email. Send an email to Imagine there, and I promise we will look into it, how to go about it, and what's the cost implication, because how many are doing it, and maybe there is something we can work with government. I think that's a very good idea. Now, one thing you need to know, and you may know, is that we have the tuition reimbursement. We have the $1,500 that if you are already an RN, you can apply to RNAO and you can receive at least one time $1,500. Imagine if you can write or Olivia where they need to apply.
Sorry?
For the tuition reimbursement, Olivia.
I'll look into that.
Put that in the chat and people can apply. No, not through RPNAO. Yes, it is through RPNAO.
RPNAO has one too.
Yes, RPNAO is for RPNs that are becoming RNs. That is correct. That is totally correct. It's not RNAO, it's RPNAO. Correct. So any RPN that is moving into RN needs to apply through RPNAO. And if you don't get it because they run out of money or whatever, connect with us, please. And the address will be Imagine, so you can raise it with me, Imagine.
Okay, so I think that we've done a beautiful job, or you've done a beautiful job, Doris, of answering all these questions. It's been a really active participation today. So I think that we have actually answered the questions, and we have just under 15 minutes left. So wondering how you want to spend the rest of the time.
Well, I want to say that the one that did a good job actually is those that put the questions. It's always a pleasure for us to answer the questions. Very thoughtful questions, very important questions. I would like to spend the last 15 minutes asking people if they can write in the chat, Susan, on what topics they would like to. I mean, always we can create the topics according to what's timely. And that's one way. Is this the way you would like, or are there specific topics that you would like for us to address the next one, and when is the next one, Susan? And also remind people of the heart-to-heart.
Sure. The next one, it's on the screen there. It's July 12th. So that's a month from now. It's a Monday, the same time. And Olivia put the registration link in the chat box. So the topic is still to be determined, I think, Doris. So there is some flexibility either in what people suggest now or as things evolve. And if you can just bear with me in a minute, I'll put up the slides about the heart-to-heart, which is Wednesday. And
so meanwhile that you put the slide, people can then think if anything else that you would like to hear. And thank you for that beautiful comment, Nicole, much appreciated. Come to the AGM. Let's not forget to say that.
Mm-hmm.
Register. Renee, can you put the registration?
Yes, so Doris, I have some slides here that we that not everyone has seen. So right here is the webinar or the open forum this Wednesday, and we encourage all of you to come. It's a pretty great topic, powering nurses' health by advocating for change. So this is about nurses and nursing students speaking up and out, and we're going to be talking about tips like how do you get up the courage and what are some of the strategies for speaking out, including some really tangible, like how to, towards the end, I think, how to use Twitter, some specific ideas there.
And come with Twitter prepared. Download Twitter before if you can. If not, we will teach you. I know Renee is here with us. Renee, maybe you can put a link of how people can download Twitter, or maybe you can tweet. No, if you tweet and they don't have Twitter, that will not help. So come prepared. We will teach you if you don't know how to download Twitter, how to tweet, how to be in the know with that.
Great, Doris. So I'm just advancing some slides if you want to speak about any of these. This is about the release at our AGM, and coming up, I've got a slide on the AGM, but we're really excited about this new best practice guideline, our 2S LGBTQI plus and health equity guideline. So we're going to be talking about that and featuring that at our AGM. And also the one member, one vote. And there's the link. I can actually put the link in the chat box in just a second. Well, maybe Doris, if you wanted to say anything about that, I'll get the
So very, very important. We have two fabulous candidates for president-elect. We have several other positions. It is your time. It is your choice. One member, one vote. Not many organizations and one member, one vote. We do have a webinar with both candidates. Renee, I don't know if you have handy the date. If not, you can please get it quickly so people can attend. And also, we do also have a session with the other candidates for the other positions. So I know, Olivia, can you get for us the date for the webinar? It's this week. Well, it got to be this week. For the two sessions, for the session with president-elect and the session of the other positions that we have open.
Yeah, and that link, all that information, if you need to refer again, the link is at in the chat box there as well.
For the sessions this week?
Yeah, and oh, we've got such a great team here, Doris. Everyone's providing all the information.
I can see. At a speed that is remarkable.
Yeah, yeah.
And I need to say that the slides look gorgeous, gorgeous.
Yeah, and this is just a reminder of the action alert for everyone to sign the take action on Bill 124. So that needs to change now to almost 5,000.
Well, by the time that, because everybody here would have signed, by the time you go back, it will be 5,000.
Yeah. And then this is our AGM here the registration. We'll put that in just a moment. So maybe you want to take a moment, Doris, and talk about the
So
registration.
the AGM will have, first of all, I think Renee put how to download Twitter. So that's very good. Thank you, Renee. I think it was Renee, I'm assuming. So we call it Protecting Ontarians and Leading Change because this is all about you guys, nurses in the front lines, RNs, RPNs, NPs, and others, quite frankly, that all they tried for these 16 months was to protect Ontarians from this damn virus, because what else can you say about this virus? And whether it was pushing for healthy public policy, whether it was pushing for, lockdowns that people didn't like us talking about that, or whether it was for vaccination and vaccinating our own colleagues, all that we were trying to do from an RNAO perspective is protect, which is exactly what nurses in the front lines were doing by taking care of people. People in nursing homes, people in ICUs, people in their own homes. Our colleagues were trying to protect them in the midst of this pandemic to keep going, and those that couldn't keep going to have a peaceful passing when the families couldn't be even with them. And our colleagues became, in addition to nurses, family members. At the same time that we were working on protecting Ontarians, we also were working on leading change. Because from the get-go, we thought, we need to leverage this tragedy to end up at a better place than where we started. And that has to do with aspects that I call now the revolution in nursing, of our colleagues saying this cannot continue this way. We deserve to be better paid. We deserve to be the ones giving vaccines because we always have done it. And why are we sidetracked now? We deserve to have a skill mix of one patient in an ICU, not 2 or 3, and less residents so we can give them, knowledge and love, both. And that's a revolution that we need to take with care and in a very, very responsible way. But leading change we will, because we need to end up with a more just and fair society for everybody. Not a society where if you are old, they forget you in a nursing home and you are the one to die, quite frankly, during a pandemic. Or if you are not with this skin color, but with the darker one, you are the one that ends up in the ICU. Or if you work in a warehouse, you are the one that ends up in the ICU. So it needs to be a society that is good for everybody, and where we stand up one with another, shoulder to shoulder, to make it better. So that's the theme of the AGM. And we will show you on how in the midst of a very intense pandemic, RNAO didn't miss a beat at all. We ended up with more VPGs, with a leading change toolkit, with policy proposals that influence to the core the health system and are reflected, for example, in the commissioner report verbatim, right? So it shows the power that we have as a nursing profession, individually and collective. That's what you will see at the AGM. And yesterday, someone in the evening tweeted from their perspective, and I respect the perspective, very upset that RNAO would have the premiere at the AGM. Oh. And I said, don't. People have a right. People are upset, guys. People are upset, very upset. And in many ways, they have a right to be upset. Bill 124 has no place. Didn't have a place even before the pandemic, let alone now, right? People that are working tripled with patients in an ICU are upset. But I answered to the tweet and I said, the AGM is not about any specific politician. We invite all the politicians and all are coming. The AGM is about RNAO and our members. That's what the AGM is about. And we are thrilled that all the politicians are coming, including the premier, because RNAO prides, guys, of working with all the political parties. Because we are not a political party. We are the political party of nurses and the public. And with that, that's why we have all the politicians and always will, regardless of who is the premier in place or who is the party in place. RNAO will always work with all parties, all politicians, and will, the person then answered very beautifully, actually, and said, now I can understand it. I hope you educate the premier. I said, of course I do. And if not, ask him. He needs to put up with me on my education and with RNAO. And so do all the other politicians, for that matter, when we are not on the same page. We educate them, they educate us, and we try to tango in the best way possible for the good of nurses and Ontarians. So that's what you will see at the AGM, and I hope you can join us.
Well, Doris, I think that's a perfect conclusion, actually, because we're just 1 minute away from 4 p.m. So it's been a very fulsome webinar with lots of great topics discussed and a really robust discussion. Thank you, everyone, so much for your questions. And we hope that you'll join us in a month from now for the next webinar.
And to the AGM next week, and to sign the action alert now. Thank you very much, everybody. And thanks, Susan, for putting this together, and to all the colleagues for helping out. Irma Jean, Olivia, Renee, everybody that was involved. Thank you so much.
Yeah, thank you.
Thank you, everyone.
Bye. Great.
Bye-bye.
Thanks, everyone.